My name is Rakesh Patel and I am a National Institute of Health Research academic clinical lecturer in medical education at the University of Leicester. I am also an Honorary Specialist Registrar in Renal Medicine at the University Hospitals of Leicester NHS Trust. This short video describes the Prescribing Insight for the Future, or Epiphany project. Epiphany uses education as an intervention for improving the knowledge, skills and behaviour of junior doctors towards prescribing medication. The project team is multi-professional and transdisciplinary, drawing on expertise from across the UK. There is representation from pharmacy, nursing, physiotherapy, as well as management, business and education on the project team. Medication errors involving junior doctors are patient safety incidents in which there has been an error in the process of prescribing or monitoring of medicines, regardless of whether any harm has occurred. We know that preventable harm from medicines costs more than £750 million to the NHS each year. The General Medical Council commissioned a study across 19 hospitals in the UK to explore this problem among foundation doctors. The findings revealed 8.9% of all prescriptions contained some form of error, which could have otherwise been avoided. Interestingly, the study also found the notion of a safety culture, which underpins safe prescribing behaviour, was absent in the minds of these doctors. We want to change this, and we want to do this by using a blend of technology-enhanced learning and face-to-face feedback. The aim of the intervention is to demonstrate a 20% increase from baseline of the prescribing knowledge and skills of junior doctors, but also develop those junior doctors as agents for change with their newly formed perceptions, opinions and beliefs about prescribing in the process. There are four main components to the educational intervention. Firstly, e-learning to scaffold knowledge about prescribing in a specific domain or clinical context. Secondly, a simulation-based assessment of prescribing performance across a range of entrustable professional activities, such as the ward round, handover, and the board round, following authentic, real-world clinical encounters. Thirdly, mobile learning devices with access to clinical decision support systems from our partners UpToDate, Lexicon and BNF Formulary Complete to provide knowledge and diagnostic decision-making support in the workplace. And finally, perhaps most importantly, personalised, face-to-face, pharmacist-led feedback on prescribing performance at the bedside. These components have been designed and developed in collaboration with institutions across higher education, as well as the NHS, to ensure the intervention is evidence-based and educationally fit for purpose. The effectiveness of education will be measured by comparing error rates, error severity, and medication error types on real prescription charts before and after implementation of the intervention. The sustainability of the project is very important. This is being established in a number of ways. To ensure the project is financially feasible into the long term, the cost effectiveness of the intervention will be calculated as part of the project. To ensure doctors will take advantage of the intervention and that it fits into their working practice, the perceived usefulness to the doctors will be captured and the usability of it will also be evaluated as part of the development. The return on investment from the educational intervention has the potential to save £1 every time a junior doctor writes a single prescription, which equates to a cumulative saving of 5.75 million across the East Midlands every month. We also expect the intervention to provide a gain in 2.2 quality adjusted life years as a result of reducing avoidable harm from medication errors. In the short term, the project will increase the knowledge and skills required by junior doctors for safe prescribing. Given the grounding of the intervention in education and emphasis on a safety culture, the project seeks to change the perceptions, opinions, and beliefs held by junior doctors about prescribing into the long term, so they value the importance of safeguarding patient safety. This will ensure every one of their clinical contacts with patients is a safe one.